Hey guys, it's Hank here. So certainly you've heard of Botox. People use it for injections of like to prevent wrinkles and, even into their scrotum. But today there's actually clinically published evidence, randomized controlled trial that actually shows that Botox makes your penis bigger. So we are going to discuss all the ways Botox can make your penis bigger, the benefits, the risks, the side effects, everything today. So stay tuned because this is a good one. All right, guys. So to start, a little bit of the basics. So Botox is from something that's called botulinum toxin, okay? It's actually basically a byproduct of a bacteria, specifically the bacteria Clostridium botulinum, okay, for all of you like microbiology nerds out there. It's a gram-positive bacteria, so we're not going to break down the differences in bacteria. I hated that shit in medical school. But it's literally a naturally occurring thing, and so you have to be careful, especially with things like canned food. If they're canned incorrectly, you can actually get botulinum poisoning, which could actually be deadly, especially in babies, and so that's why you don't give babies honey. But what they've been able to do is actually take a specific type of the botulinum toxin, the onabotulinum toxin A, and they have turned that into different therapeutic treatments, okay? Basically what it does is it helps to prevent the release of acetylcholine and norepinephrine, things that are necessary for basically different nerve functions, and it can literally cause paralysis. But here's where it gets interesting, because not only can it cause paralysis, it can also induce things like vascular endothelial growth factor. The authors of this paper, which we're going to talk about today, actually thought that because it can actually paralyze muscle, specifically, it might help with the smooth muscle dilation in the penis for people with erectile dysfunction and blocking those sympathetic nerve transmission. So I'm not going to get all sciencey here, guys, but I've talked about it before. But the parasympathetic response is what's responsible for actually developing an erection. So the sympathetic response, like the fight or flight response, actually prohibits smooth muscle relaxation, and that's what can actually prohibit you from getting an erection. So people that have like hard flaccid or a penile injury, they get all stressed about it. They're sending these sympathetic signals that prevent the actual penis from relaxing, and it causes this cycle of worsening erectile dysfunction. And so that specifically is where Botox could come into play. Also, the authors of this paper talk about specifically how the expression of these factors and the activation of its downstream cascades from Botox enhance vasodilation, okay, allowed more blood flow to the area, and endothelial cellular proliferation, two things that we want to happen. So between blocking the sympathetic function, causing the smooth muscle dilation, and proliferating smooth muscle cells or the endothelium, that is actually in itself could be very fortuitous for us that are trying to go for penile enlargement. So in this trial, they included men between the ages of 40 and 70, and specifically in this trial, they used men that were not really responsive to medications like Viagra or Cialis, okay? So they were non-pharmacologic responders. Now, they measured bone pressed, stretched, flaccid length, okay? Now, in this paper, they talk about, quote, that bone pressed stretched flaccid length is the equivalent to erect penile length based on a study that they quote. I don't think it's equivalent by any means, but I think it is a reasonable surrogate. If your stretched flaccid length is increasing, then you know your actual penile length is going to increase as well. In my opinion, it just has basically a 3 to 6 month lag time. And guys, if you want to learn how to get bigger, I have my course. I talk about like all of these different factors you can measure to actually know whether or not you're growing. Link is in the description below. And in this trial, what they did is they randomized guys to either basically placebo, just injecting saline, injecting 50 units of Botox, or injecting 100 units of Botox. They did it one time, and then they measured their basically performance at 0, 3, and 6 months. Performance including penile size in both length and mid-shaft girth, and as far as things like different sexual function quality measures. And before we get into that, guys, if you just take a quick second to like this video and subscribe, okay? But what they found is that the stretched penile length increased significantly in both the 50 and 100 units of Botox. There was no significant increase when it comes to the actual placebo, okay? So only with Botox in this randomized control trial did they see that. And so what they saw was a centimeter increase when it comes to the 100 units and a half centimeter increase from 12 to 12.5 centimeters when it came to the 50 units of Botox. In neither group did they see an improvement when it came to girth, and in both groups they saw an improvement in the SHIM score, which is basically one of the measures of actual like erectile function that is standardized in the medical field. Interestingly, when you look specifically at the 6 month interval For the 100 unit group, you had improvement that was consistent at 3 and 6 months. However, in the 50 unit group, it went up at 3 months and then went back down a little bit at 6 months. Okay. So they did see that the 100 unit group was better. Now, they also reported side effects, guys, and these are important. I'll say, first of all, anytime you're injecting into the penis, that has inherent risks of pain, and obviously injecting a foreign substance increases the risk of things like sepsis, okay? Or basically an infection of your penis that in its worst could lead to penile necrosis. And actually in its worst, it could lead to actually sepsis, or when your body gets like overcome by bacteria, which can lead to death, okay? Not good. Now, they didn't report any of that in the studies, but they had one patient that had priapism. Now, keeping in mind, this was when combined with trimix, okay, that they were doing when they were evaluating the penile function with Dopplers. But they had patients that also had pain and had hematoma. So guys, it is no trivial matter to inject your penis with anything. Just use that with caution. Now, interestingly, and I've talked about this study before, I've made another video about chemical PE and why I personally never recommend it, but included this trial where it looked at these complication rates with injections, guys. Now, these were guys that were chronically injecting their penis with PGE1, but complications were as follows. Plaque formation in 10%. Okay, 1 out of every 10 developed a Peyronie's-like symptom, okay? Penile pain in 2%, bruising in 1%, restlessness 1%, tissue damage 1%, okay? The same study author claimed that 27% of the patients complained about penile shortening, while 1 in 5 of them developed a new curvature of their penis from injection, guys. So if you are thinking about injecting into your penis, I would just strongly advise you, based on the data that you're seeing here, to use a lot of caution when considering that. So what are some of the important discussion points, okay? So part of the discussion point is that this is a non-nitric oxide mediated pathway. So we've talked about it before, guys, but nitric oxide is basically the gatekeeper for erections. It's what allows the smooth muscle dilation, and that's why it's so important. In theory, they could work synergistically together between having the smooth muscle dilation and having the Botox injection. And so here's a pretty interesting quote here. They said, these effects might lead to a decrease in the tone of resistance of penile vessels, an increase in resting blood flow, and a reduction of the persistent cavernousal smooth muscle tone. So the Botox injection induces sinusoidal dilation, meaning the tissue of the chambers of the penis dilates, which seems to be mediated by smooth muscle relaxation. So it is kind of like a direct smooth muscle nerve signal inhibitor, for lack of a better word there. Now, you know I love my rat studies, guys, because there's not a lot of studies on actual adult or human penile data. In this rat study, they also found that Botox would actually increase the intracavernosal basically dilation and the pressure, meaning an improvement in erection quality. So especially in some of you aging guys, Botox might be even more helpful. Now, what was the general response rate to Botox? The response rate is somewhere between 50 to 61%. So that means basically a little better than, 1 out of every 2 guys responded to this. So it's not like this is a 100% treatment. So can you imagine having a needle injected into your penis for a treatment that doesn't work? Not ideal. Now, guys, here's a paper that actually looked at combining with prostaglandin E1, which can help to facilitate erections. Combining that with Botox did lead to slightly better erection quality. In my opinion, this paper was not like, oh my God, overwhelming, but they do work together okay. I wouldn't recommend either of them, but it's interesting data nonetheless. Now, everybody in the Acorn gang, meaning the growers, okay, the guys that have very, very small flacids, okay, like I used to be, hence why my brother coined the term Acorn gang, because it was like a little tiny acorn sitting on top of our testicles. But in this study, they showed an improvement in basically the flaccid size, especially the stretched penile length. But here's a study here that actually showed that you have a dramatic and significant improvement in the penile retraction. So you can go from a grower to a shower just from having Botox injections. You just have to keep in mind, unlike something like manual stretches or pumping, which is going to permanently increase the size of your flaccid penis, the Botox, if you're not doing any kind of PE, your penis is going to retract to basically its normal size once the Botox wears off, probably somewhere around 3 to 6 months, depending on how many units you get injected into your penis. And so, guys, what's the cost? Well, I haven't found the cost specifically for penile injections, but for Scrotox, for guys that want their balls to hang lower and to maybe have a little bit less wrinkles in your sack, if you're interested in that, it's called Scrotox. Just look it up. I don't see any application for PE, but typically that's somewhere around $500 to $1,000 per injection, okay? I would imagine it's even more if it's going into your penis, but the price range is somewhere around there. So, guys, it's expensive. So guys, what are my takeaways? Well, number one, if you are severely insecure about the size of your flaccid penis, Botox will increase the size of your flaccid penis. Do I think it's going to actually significantly increase erect size? It can, through improvements in erection quality, so you can maximize the size you have, but I don't think you're going to actually be pushing boundaries, like actually expanding your penile tissue with it. Now, that being said, is there a role in combining it with PE? Possibly, okay? Because you're blocking that sympathetic function, you're going to get better erection quality, you get more stretch, more relaxation of the tissues. It could, in fact, help with PE. Now, that being said, I'm not certainly doing it, and I wouldn't suggest any of you all do it. If somebody wants to, for science, get Botox injections into their penis and combine that with, traditional PE techniques and report back to the group, by all means, let me know. We might even be able to crowdfund that for you. Leave a comment below if you want to be that guy. But I personally don't think this is promising, and I think the stretch flaccid gains that they saw are going to wear off once the Botox wears off. Similarly, though, you have increased VEGF expression, which could potentially help facilitate growth of the penile tissue. Now, where I think this has a better application is people with hard flaccid, or people that are in their head about their penis, whether it be their injury or what, and therefore they can't relax and they can't get an erection. Botox could absolutely be a game changer. And so if you have hard flaccid and you have tried all of these other traditional methods, and, I do talk about this in my course, my hard flaccid course, the link is in the description, but you could consider Botox injections into your penis to see if that blocks that sympathetic signal and allows you to relax and get over your hard flaccid symptoms. Absolutely something to consider. And even sometimes there's Botox injected into the muscles of the pelvic floor to get them to relax. That's going to do it for today, guys. I hope you enjoyed this video. If you did, please leave a thumbs up. Take a second to subscribe if you haven't already. Remember, there's nothing wrong with self-improvement, but you are enough just the way you are. So until the next one, guys, peace and love. Join my subreddit, r/Hink. I think that's about it, guys. All right, peace.
Dr. Hink got the plug on the health, yeah. Got you thinking about your wealth, yeah. In his office, no